When life gets unpredictable, preparation matters. In medicine, it's all about staying alert, ready for whatever comes through the door. On the road, it's no different. That's why Volvo designs vehicles to help anticipate risk, reduce harm, and protect lives. The Volvo XC90's advanced safety systems inspire confident decisions wherever the road takes you. The Volvo XC90, for life. Proud sponsor of the Pit Podcast. Learn more at volvocars.ca/safety.
All right, hour 2 of the program, and we'll kick things off here by tackling the medical side of COVID-19. We'll discuss blood transfusions, plasma transfusions, and some questions around that. But first, let's say hello to Dr. Chris Labos. Hi, doctor.
Hello.
Listen, earlier this morning, Dr. Mitch Schulman was on with Andrew Carter.
Yeah.
And there was a moment from that segment that we want to replay here because I think it's important that people hear this. And we just heard the projections from Dr. Tam. There's a lot of good, by the way, that came out of these projections, some very good signs. But I do want to get to the difficult decisions being made in hospitals. First things first, let's listen to Dr. Mitch Schulman.
Yesterday was the first shift. I've done other shifts in the Emerge, but yesterday was the first shift where I was actually dealing with people who were COVID positive or potentially COVID positive. And it's a very different world. It's a very different experience. I'd almost say it's a scary experience in many respects. These patients are by and large scared. These patients are by and large sick, very sick. Look, I don't wish ill on anyone, and having the conversation won't make things happen to you, but I would strongly urge all of you listening to think about what you would want done to you if you were to come down with this disease. And I mean this very specifically. Are you someone who would want us to put you into an induced coma, put a tube down your throat, put you on a ventilator, and put you on that machine for as long as it takes to necessarily recover? So far, our statistics in terms of recovery from people that we put on a ventilator are really not very good. We cannot predict in advance who's going to recover, who won't. And so this is a very important conversation, and it's best to have it now, when you're with it, when you're feeling okay. And then the other comment I would make is, please make certain that your loved ones know what you want. I was through this a number of occasions yesterday. Elderly person is brought into the emergency room, huffing and puffing, not doing very well at all. If we're going to, we have to tube them immediately, which is the slang for putting down that tube into their airway. Intubation is the official term. We've got to do it right then and there. And you can see the fear in their eyes. This is not a conversation that's pleasant to have, especially when you are very sick. And so, for your own sake, and it's not tempting the devil or whatever terminology you want to use, it's not jinxing you, it's not doing anything, but it's very worthwhile to think through what would I want and to make sure that the family knows.
That's Dr. Mitch Schulman speaking with Andrew Carter this morning. Dr. Labos, you heard that. What do you want to add?
So just a sort of a couple of caveats. I generally agree with that. Everybody should have a conversation with their family about what their advance directives are, meaning, do you want to have CPR? Do you want to be intubated? Regardless of whether it's for COVID-19 or something else, you should always let your family know what your wishes are. There are some people who are going to say, I want everything done. If I'm going to die, I want to be dragged kicking and screaming into the afterlife. You do everything that has to be done in order to in order to prevent that from happening. And other people say, look, I'm of a certain age. When it's time for me to go, it's time for me to go. Don't take any heroic measures. So that's a very personal decision, but I think it's also a decision that has to be made regardless of the current outbreak. This is something you should be talking to your family about chronically, like when this virus passes, and it will pass, other things are still going to keep happening. Heart disease is going to keep happening. Cancer is going to keep happening. So it's good to let people know, because what stresses your family out is that they're trying to think what you would want. And if you haven't told them, they won't know. So you can either tell them verbally, you can either make a living will to have it documented. But it's important to have this stuff clear, because the most important thing is what you want. If you're incapacitated, it's now other people making the decisions for you, and they might make decisions that you don't want. one sort of positive note to put on that, yes, when people get intubated, it's very, very bad. The vast majority of people are not going to be intubated because of COVID-19. Most people will be fine. It's a tough virus, but a lot of people will be okay. A minority of people will have to go to the ICU and be intubated, but just that we don't scare people. A lot of people are going to be okay, and don't forget this virus is going to pass with time. And if you want to avoid getting sick, the most important thing of all, the point we keep bringing up, stay home. If you stay home, you can't catch the virus from anybody.
Yeah, and Dr. Labos, as we look at the figures, the stats, the projections from Dr. Theresa Tam this morning, they definitely make that case. Canada, at this stage in the epidemic, it's faring favorably compared to a lot of other countries, and that is a very positive sign. And when you look at their projections, and I'm looking at images right now, if we keep doing those stronger controls where people stay in their homes as much as possible, boy, the impact on the number of cases, on the number of deaths is just so significant. So a really good indication why we need to stick to what we're doing, double down. And even if we see some good numbers and we see the curve flattening, not to let up. If you want to give us a call, by the way, 790-0800, Dr. Labos will try and answer a few of your questions over the next little while. Before we do that, Dr. Labos, I want to talk about plasma transfusion. And we are hearing about, when you can take someone who's recovered from COVID-19, filter their blood, and try and treat others with the infection this way. Tell us more about that.
Yeah, so the idea is that once you get the infection and you're cured, right? Once you pass the infection leaves your system, you still have the antibodies in your bloodstream. And so the idea is that if you can transfuse somebody's blood plasma, you will be giving them a transfusion of antibodies to help treat that person. And this is not a new idea. It's been done multiple other times with multiple different diseases. And this has been tried in the U.S. and in Canada too. I think it's still an experimental procedure. It's being tested properly. It has a couple of limitations. So people ask, well, why aren't we doing this more? Where can I donate blood? Well, first of all, we don't have that many people who have recovered from coronavirus yet, right? There's the number of people who are cured, who have recovered, who might have antibodies in their blood is still relatively small compared to the people who are actively sick. The second problem is you have to be eligible to give blood, right? So if you have any type of other viral illness or some other thing that would disqualify you from giving blood, you wouldn't be a potential donor. And the third problem, and probably the biggest one, is how much antibodies can you extract from a single person? If every person can only generate enough antibodies or can only donate enough plasma that has enough antibodies to treat maybe one or two other people, well, that's a problem. That's not really a scalable illness, right? If it takes one plasma donation to treat one person or two people, when you think that we're going to have thousands of people potentially infected, logistically, I'm not sure that's going to be a very useful strategy for treating the whole population. And of course, the caveat is we're not actually sure that it really helps all that much because it's never actually properly been studied. There were some reports of physicians giving these plasma transfusions to patients saying, oh, look, they got better after 3 or 4 days. But you don't know if it would have gotten better anyway. So until it's studied in a randomized trial fashion where you can compare against people who got some sort of placebo, you won't know if it actually makes a difference or not.
And
yeah.
Just what you're saying there is just so important for all of the things we hear about, whether it's a drug treatment or any type of treatment. If you're not doing a responsible, proper study, you don't know if someone was going to recover anyways, with or without that treatment. Really important. Dr. Labos, stick with us. For those of you listening to us, if you've got a question for Dr. Labos, on the flip side of this, we will take some of those. You can call us at 790-0800. And when we return with Dr. Labos, I'll have a question for him about jogging. And do you actually need to increase the 2-meter distance when you're on a jog or you see someone on a jog? That's next. All right, I'm going to try and get some answers. See if there's some answers with regards to joggers. See joggers? I've been jogging on the weekend, right? But I make sure when I'm jogging that I space myself out as much as possible. I don't do 2 meters when I'm jogging. I don't do the same sidewalk when I'm jogging. I do opposite end. I go in the road as opposed to putting someone at risk. I want to know if I'm smart in doing that or not. We'll get to that in a second. But first, let's get to the phone lines. Rose is in Côte St. Luc. Hi, Rose.
Hi.
You're with Dr. Labos. What's your question for Dr. Labos?
Okay, Dr. Labos, I would like to know, there are a lot of people walking their dogs, and there was on the news about dogs getting the virus in their hair. What can be done, or should people keep their dogs right by their door?
Yeah, so there's been some, it's rather unclear if animals can actually transmit the virus or not. It's important not to overstate the importance of a lot of these preliminary pieces of research. The one thing I would keep in mind, though, you shouldn't be getting close enough to someone's dog because you shouldn't be getting close enough to the dog's owner, right? So if we're going to maintain social distancing to stay away from people, presumably that dog is walking around with another human being, you should be staying away from both that human being and that dog because you should see them as sort of one unit, right? So regardless of whether the animal can actually transmit the virus or not, which I think is probably pretty doubtful or very limited, you should be staying away from both dogs and their owners.
All right, Rose, thank you very much for the question. Let's go now to Carrie in Côte St. Luc. Hi, Carrie.
Yes, hi, good morning.
Good morning. What's your question for Dr. Labos?
Yes, I'd like to ask Dr. Labos, if you want to do cleaning in your house and you don't have gloves, is that okay?
Yeah, I mean, as long as you wash your hands afterwards. I mean, so if you're cleaning a surface with either soap and water or with some sort of bleach dilution or with, these Clorox wipes that exist, I mean, whatever you do, as long as you wash your hands afterwards, you should be okay. Just give your hands a good wash with soap and water. Do it for at least 20 seconds, and you will be washing away and killing any virus that may have transferred onto your hands. Just don't touch your face while you're doing the cleaning.
There you go. Thank you for the question, Carrie. Okay, Dr. Labos, can we get to my jogging question? I saw some research data on this. What can you tell us about, it's one thing when you're walking down the street. What happens when you see someone jogging? Do you need to take any more special protection?
Yeah, so this research was really sort of done in these sports labs where they looked at how people breathe and how far their breath vapor spreads when they're jogging and breathing more heavily. And, what they found was, perhaps not unsurprisingly, that when you're jogging and exercising, your breath is spraying over somewhat larger areas. So they've suggested that maybe the 2-meter rule should be a little bit more extended if somebody's exercising. I think what you suggested is very reasonable. If you see somebody jogging, really cross to the other side of the street. But then again, you should probably be doing that if people are just walking too.
Mm-hmm.
So the one thing that has me worried with the warmer weather, I'm worried people are going to start going outside more and clumping together on sidewalks. Remember, the 2-meter distance is sort of the bare minimum. If you can do more than that, really just spread out as much as possible.
And you know what? I just want to say, Doctor, to me, I'm looking at that 2 meters and I say that's the bare minimum. Every single meter I can take, I'm taking it, and to me, I'm sort of because I walk to work, and when on my walks to work, I'm heading into the grass, I'm moving over all the way, and I would love for everyone else to get into that habit. Let's try and keep the maximum distance at all times. If you can, if you've got that meter to spare, let's use it because it can only be helpful in this situation.
Yeah, I mean, absolutely. The streets are relatively empty. So, obviously don't do anything dangerous. Don't walk out into the middle of traffic and get hit by a car. But, spread out. Or, if you see somebody that's walking close to you, stop, let them advance a little bit and keep your distance from this person.
Yeah.
I've seen a lot of people really almost clumping together on sidewalks, and you sort of have to wonder what they're thinking. Really just keep your distance as much as possible is probably for the best.
And of course, that's why the city of Montreal is going to change things up on Mount Royal for a large stretch of it to try and make sure people have more space to move out. Let's get back to the lines here. I want to go to Debbie in Vaudreuil. Hi, Debbie.
Hi there. Hi, Dr. Labos. I have a question. I'm a receptionist at a seniors residence in my area, and I have been off since March 15th, scheduled to theoretically go back on the 13th of April. Am I presenting any sort of new risk by having been away so long and going back? Can you tell me about that, please?
I mean, probably not. It really depends on what you've been doing over the past month. If you've been pretty much at home and not in contact with other people, very unlikely that you would be infected. Risk is never zero because we can never be 100% sure. But the best. Sorry, go ahead.
I've been shopping for my mother and delivering to her and doing that for her on a weekly basis. Is that sort of any sort of risk?
Well, here's the thing. I mean, everything carries a certain amount of risk. It's all about minimizing the risk and keeping it as controlled as possible. I would certainly say that if you ever develop symptoms in the near future, tell the people at your, at the home as quickly as possible. You certainly shouldn't be going in there if you have any symptoms. But the most important thing too is try not to have direct contact with any of the patients. Try not to have any there shouldn't be visitors, but try not to have direct contact with other people and maintain your distance even at work. Wash your hands frequently. And that's probably the most important thing you can do is, remember, the virus can only spread from you to other people. So if you maintain your distance from other people, even if you have to physically be at your job, you're doing something to prevent the spread of that virus.
Thanks.
Okay, and wearing a mask wouldn't be some sort of great assurance that would be protecting everybody else from me coming in?
So if you can make your own mask at home as per the instructions that are on the internet, and the CDC actually has shows you how you can do that by cutting up an old T-shirt. It's pretty simple. If you want to do that, you can. The one thing I would remember is, one, a mask doesn't actually replace social distancing and washing your hands, so you got to still keep doing the other stuff. And you have to be careful that you don't fiddle with the mask. What happens with a lot of people is they end up fiddling with the mask and spreading the germs to their hands and to the rest of their face.
All right, Debbie,
Okay.
thank you so much for the call. Let's go to Susan in Montreal. Hi, Susan.
Yes, hi. I find that, I wake up in the morning and the whole day is filled with contradictions when you listen to the TV and the radio. They say, okay, don't really go out shopping. Don't go out, stay at home. Okay, so you stay at home, then everybody's calling, how do I clean? How do I clean? What are you cleaning if you don't go out in their house?
Okay, so doctor.
It says use soap. Soap is good. It doesn't like the virus. So why the Lysol? What? I don't understand. When you go out, you need the sanitizer because you don't have a bowl of water with you. But if we're not going anywhere, why is everybody talking about how to clean in their house all the time?
Doctor, handle this one.
Yeah, and that's actually a great question, and you raised an important point. If you don't go outside, if you have essentially isolated yourself off in your house, your risk of getting the virus is essentially zero. Remember, the virus is not coming through the walls. It's not floating in through the air. It's spread from person to person. So if you have the ability to stay home and have no contact with other human beings, you're essentially sitting pretty, and you probably don't have to worry all that much. And that's why we keep hammering this stuff in. The advice we keep giving about cleaning is to recognize the fact that most people still need to have some degree of contact, either to shop, and some people, still have to go to work. They can't stay home. So that advice is really geared towards those people. But you raised an interesting point that a lot of this is being driven by fear, whereas for a lot of people, again, if you do the basic stuff and stay home, your risk is essentially zero. So I think it's a good point you've highlighted, because we need to get that home. You need to drive that home.
Okay.
All right, Susan, I got to let you go there, unfortunately, because we're out of time. But we will take more questions tomorrow at the same time, 10 a.m., if you've still got them. Dr. Labos, you're a champ. Thank you so much for joining us.
My pleasure. Stay safe.